Tonight, it's official. Roughly 600 Allina Clinic doctors, nurse practitioners, and physician assistants have successfully unionized, and it creates the largest private sector doctors union in the entire country.
And now people have a lot of questions about what this means. Yesterday, Allina Health told our Renee Cooper they will not be challenging the effort. She's live right now in St. Paul. And Renee, you're learning more about when negotiations can begin and what that means for patient care.
Lindsay, that final procedural step was just completed this evening. The National Labor Relations Board has certified the election, officially forming a new union for Allina doctors. Give me your reaction.
I'm so thrilled. I'm so excited.
I believe as soon as tomorrow, if things go efficiently, we can start trying to talk about bargaining.
Allina doctors from across the metro reacting to the news that their year-and-a-half effort to unionize has paid off.
I'm happy.
Bringing together 60 Minnesota clinics and one in Wisconsin as a unified voice. Unlike other labor disputes in the national spotlight, these providers say it's not the pay they're fighting for, nor better benefits.
It sounds cliche, but I think the most important thing that we are asking for is a seat at this table.
We really just want a seat at the table.
To be able to have some of the power back in the hands of the people who are actually taking care of the patients.
Power to advocate for decisions they hope will improve patient care. First on that list, for clinician after clinician, is loosening clinic metrics, which, as Dr. Kristen Sanders-Gendro explains, are measures of a provider's productivity based on the number of patients they see and how much those patients' health improves under their care. Some of that data, she says, is important, but others get in the way.
Maybe just getting better is all someone can hope for, but to meet this measure, you really have to push patients harder than perhaps that individual patient needs to.
Being able to really tailor in medicine for their specific needs is what we were taught how to do and what we've been doing less of, and what I think a lot of us are really excited to try and get conditions moving so that we can get back to it.
I think we've made it clear that it's really important to the health of our community and to each individual family.
As you just heard there, union organizers have spent the last year and a half working to get to this point. Now they're expecting to spend the next year and a half bargaining with Allina Health before that initial contract can be signed. Now, Allina Health, in a statement in response to that today, told me it would, quote, be premature and speculative to discuss the potential impacts of a labor contract that has not yet been negotiated. They're adding, quote, the addition of a union does not change our unwavering commitment to the communities we serve, nor does it impact their access to care. Live in St. Paul, Renee Cooper, 5 Eyewitness News.